Good afternoon, guys. Now, B, we're discussing unexplained bruises, multicolored bruises on hands, different parts of people's bodies. So here we go with the presentation I made. A multicolored bruise on the hand is a small, vivid drama under the skin, a sifting platelet of purples, greens, yellows, and reds that can feel strangely expressive, even ominous. When it appears unexpectedly or behaves in ways that don't match a simple bumping or a simple bump or knock, it becomes more than a cosmetic curiosity. It becomes a question, and often that question is about health. The multicolored bruise, a small story with larger implications. A bruise, at its core, a story of blood escaping its usual boundaries. When tiny vessels rupture beneath the skin from a direct blow, a twist, a pressure, or sometimes no clear cause at all. Blood pools in soft tissues that follows it is a what follows is a slow, predictable uh, metaphorous. The the bruise darkens, spreads, softens, and eventually fades. But when that bruise appears on the hand, a place of consistent movement and delicate autonomy, its evolution can feel more dramatic. And when the bruise is multicolored, layered like sediment, it can spark questions about what else might be happening beneath the surface. The color, the color wheel beneath the skin. The colors of a bruise are not random. They reflect the biochemical breakdown of hemoglobin, the pigment inside red blood cells. As the body cleanses or cleans up the spill, red to deep purple, fresh blood pooling under the skin, blue to violet, oxygen leaving the trapped blood, green, benevolent, lever, dent, normal, breakdown product. Yellow, bilirubin, that final stage before reabsorption. This progression is normal. It is the body's cleanup crew at work. But the hand, with its skin, its thin skin, and rich vascular network, often displays these colors more vividly than other parts of the body. When a bruise becomes a signal, most bruises are mundane. They heal without fanfare. But some bruises, especially those that appear without clear injury, expand rapidly or come with other symptoms, can be early cues to broader health issues. Unexplained bruising. A bruise that appears without a remembered injury can feel unsettling, while everyday bumps often go unnoticed, unexplained. Bruising can sometimes point to issues with platelets, clotting factors, or vessel fragility. It is one of the reasons clinicians pay attention when patients say, "I don't know how this happened." Bruising that spreads or deepens. The hand is a compact structure. A bruise that spreads across the palm or into the fingers may reflect how easily blood tracks through soft tissue planes. But when spreading is rapid or accompanied by swelling, firmness, or intense pain, clinicians sometimes consider whether a deeper hematoma is forming. Bruising paired with other symptoms. Bruising rarely exists in isolation. When it appears alongside fatigue, joint pain, a new new medications or repeated episodes, it becomes part of a larger clinical picture. Bruising with numbness, tingling, may indicate pressure on nerves. Bruising with joint swelling can sometimes accompany inflammatory or autoimmune processes. Bruising with fever or malaise may prompt evaluation for infection related vascular changes, though these are uncommon. None of these patterns point to a single diagnosis. They simply widen the differential and encourage a clinician to look more closely. The hand as a diagnostic canvas. The hand is a storyteller. Its bruises often reveal more than those on the high or thigh or shoulder, because the anatomy is so compact and expressive. A bruise on the palm may interfere with grip. A bruise on the dorsum may swell dramatically because the skin is thin. A bruise near a joint may raise questions about tendon or ligament involvement. Clinicians often examine capillary refill, how quickly blood returns after pressure, sensation to ensure nerves aren't compromised, range of motion to check for deeper structural injury. Patterns of discoloration to distinguish normal evolution from usual spread. These assessments help determine whether the bruise simply is simply healing or whether it's part of a broader process. Why bruises sometimes spark large health concerns. Multicolored bruises can be the first visible sign of something systematic. Not always, not often not, but sometimes. That's why clinicians pay attention. Bruising patterns, especially when they are new, frequent, or unexplained. Conditions that can influence bruising include platelet, platelet, platelet or clotting disorders, medication effects, blood thinners, steroids, SSRIs, and others. Nutritional nutritional deficiencies, particularly vitamin C and K, vascular frigidity, more common with aging, autoimmune conditions, when bruising pairs with inflammation. These are not diagnoses, just examples or of the broader landscape clinicians consider. The emotional weight of a bruise. Bruises are intimate. They appear suddenly, change daily, and demand Give me 1 second. Attention. A bruise on the hand can interfere with work, writing, cooking, caregiving, the small acts that define a day. When its colors shift unexpectedly, it can feel like the body is telling you a story you didn't ask to hear. It's natural to feel concern, especially when the bruise doesn't match a clear injury or seems to behave strangely. That concern is vivid, and it is worth sharing with a clinician who can examine the hand directly and decide whether further evaluation is needed. When to seek medical attention, because this involves a visible change in your body. I want to be clear and supportive. A clinician should evaluate bruising that is unexplained, worsening, unusually painful, or accompanied by other symptoms. They can examine circulation, nerve function, and tissue integrity and determine whether labs or imaging are appropriate. And this isn't about alarm, it's about clarity. A multicolor bruise is a small event with the potential to raise larger questions. Most of the time, it is simply the body healing itself, a vivid, visible way. But sometimes it is a nudge, a reminder to pay attention, ask questions, to check in with a clinician who can see the bruise in context. Okay, guys, that is your B for now. I will be back on later for shows. Until then, Gator Wellness, take care, folks.